How you doing?
Hey Khaled, how are you?
Good. How you holding up with all the new rules, data, and
All the changes. So
I,
we were hearing there may be changes, but of course we didn't have the framework that was sent to me about 4 in the morning, and then we
oh,
didn't know when it would take effect. So I will share that we did have briefing calls this morning with the minister and Dr. Williams, and we're told that yes, on November 7th, so at 12:01 Saturday morning, the new rules come into effect. And you're quite right. We are in the restrictive phase or the restrictive category, but Mississauga, very close to the protect, very, very close.
that's the
First,
yellow, right? Yeah. Okay.
very close.
So let
So
me ask you this. I'm sure you got the big binder at 4 a.m. in the morning, right? You said, what does orange mean to the people in Mississauga and people?
So the good news is that we had been asking for businesses to be reopened safely when it was safe to do so, and to find a way to allow them to reopen and yet protect our residents, of course. So we know that restaurants and bars and pubs and gyms were not the source of the spread here in Peel. And so we didn't necessarily agree that they should be closed. However, two arguments on that front, and this I actually responded to that question yesterday in the Premier's press conference because I was invited to participate over at Trillium Health Partners when we had the announcement on long-term care. And first was the spillover effect. If Toronto was open, we were closed, then, you know, people would come here to restaurants, use the gyms, etc. And secondly, we were facing an uptick in numbers. There's no denying that. And Dr. Lowe feels very strongly that at the beginning of October, when we went back into phase 2.5 from phase 3, it came at the right time. That the numbers may have grown exponentially, and it just kind of enabled us to take that pause and recalibrate and just say, okay, everyone, we need to focus on this now because I think we got a little sloppy. In July and August, there were too many parties. September, October, you saw the numbers climb. In September, that was to be expected as the kids went back to school, people went back to work. But what we've been seeing is the effect of Thanksgiving. So
Yeah.
immediately, 2 weeks after Thanksgiving, we had a huge spike. And that was social gatherings, people getting together for large dinner parties and kids getting together, whether it's backyard parties, coffee parties, hanging out together. And you could see the effect. Literally 2 weeks later, the numbers took a huge spike. So Dr. Lowe felt they came at the right time. And then I became concerned because, of course, last weekend was Halloween. I thought, oh no, in 2 weeks, will we have another spike again? But certainly it wasn't fair to those businesses that have been keeping us safe. You know, that there was no transmission other than 3%. I think there were 3 cases in the 7,000 restaurants. And largely it was a staff person, not transmitted to patrons. So was it fair that the restaurants and pubs and bars and gyms closed? And they weren't the source of transmission. We didn't have cases of outbreak in those facilities, in those businesses. So we rightly were advocating that they be allowed to reopen. But then Dr. Lowe, who agreed, because he had to sign off, by the way,
Okay.
on permission to allow those businesses to reopen. But he felt very strongly there had to be a trade-off. If we know that the transmission is on social gatherings, community settings, households, to some degree, as we see in Brampton workplaces, that's more so Brampton, those large manufacturing plants, food processing, etc. Then are still our dinner parties, gatherings. There had to be that trade-off. And so he said, okay, but I'll have to put more restrictions in place on social gatherings. And we said we would agree with that if you allowed the restaurants to open safely. And, I immediately heard from restaurants that they were disappointed that there would be the early closing. And whereas in Oakville, they can serve till 11 p.m. And close by midnight, here we can only serve until 9 p.m. and close at 10 p.m. And we're very close to being in that other category, but we still have a ways to go with Brampton.
So
So
let me. So what does this mean? The orange tier for restaurants means what?
it means they're open for indoor dining as well as outdoor dining. They're only permitting indoors 4 people per table.
Okay.
Okay. If you're in Halton, which is Oakville, 6 people per table. Okay.
Okay.
And they have to stop serving alcohol by 9 p.m.
Okay.
and close by 10 p.m.
Okay.
If you're in Halton, you have to stop serving alcohol by 11 p.m. and close by midnight. And you can
Okay.
have 6 people per table. So there are some differences, right? But the good news is, the gyms can open, have 100-person capacity and 10 people per class. And so it allows me to go back to F45 inside.
Yeah. Okay. So,
It's been cold. It's been cold outside. Good
so
thing
let,
I'm a
let me.
skier and have lots of layers. But we have to continue to be careful, okay? So there will be restrictions on social gatherings and to prevent further community spread. So Dr. Lowe is looking at that today, and I'm going to get confirmation on a 5:30 call tonight, just after you. And tomorrow, of course, both Mayor Brown and I will have our press conferences, and Dr. Lowe will also present, and he will outline his new restrictions on social gatherings, and that may include restrictions on weddings, funerals, and those kinds of family gatherings, right? Because we know in those settings, people feel more comfortable because they're with family, they embrace,
Yeah.
they get close, and they're family, so they don't necessarily wear their face covering because they're with people they know and love. And they have been the source of transmission. One of the super spreader parties, as we know, was a wedding in Vaughan at the Avani Banquet Hall. No question. A lot of those people were from Peel. And I think the 44 people were infected, 33 of them from Peel, I believe, causing over 100 people to be infected.
Okay.
Household spread.
Now, let me ask you this then. Does the chief medical officer now, Dr. Lawrence Lowe, have the ability to close down neighborhoods and cities in regards to,
No.
is it still the province that is in charge of that to put it
Correct.
into a higher tier?
Correct.
Okay, he wasn't definitely clear on that today.
No, only the premier does, and he knows that.
Okay.
So, for instance, Dr. Lowe can close down a restaurant
Okay.
ABC, because there has been a COVID outbreak in restaurant ABC, so I'm closing you down. But Dr. Lowe can't close down all restaurants or put in restrictions for all restaurants. Mind you, the city can pass a bylaw, which we did, which limited capacity to 100. We did do that, but now capacity is lower for restaurants as prescribed by the new framework by the province, superseding ours. Province's legislation always supersedes ours. So it's in 50 people capacity. And I think about restaurants that I'm aware of, like La Castile, that I know they have a 500-person capacity. They could probably serve, 250 people safely. Our capacity limit was 100, and right now the premier has decided that in the orange zone, as you call it, the restricted, is 50. So I'm just looking to see what it is for the Haltons of the world, Halton and the other areas.
Yeah, I was actually out yesterday at Oliver's Steakhouse. First time out since March, actually, and so I went pure baller and went to a nice dining room.
Wow, look at you.
It was first time since March.
Getting swanky. Swanky. I'm just looking for the limits here.
So
50 people out, 50 people indoors. I think it's still the same, 50 people indoors, 100 people. I'm just looking at the notes.
So, Mayor Crombie,
it's all very new, right? We just got
today, So what does this mean for gyms then?
Again, the same capacity, I believe, although I heard it was 100, but
no, I heard it was
let's 50. Call it 50. 50 people capacity in the gym.
Yeah.
And that's notwithstanding some of those bigger gyms like Lifetime can hold many, many more people. That's it. And 10 people per class.
Okay. And I heard that they have to be 3 meters apart now within a gym instead of 2 meters.
Well, and we understand why, right? Yeah. You're breathing heavily, you're sweating, droplets, etc. Okay. Right? There's huge capacity. Plus, you're not wearing your mask and you're huffing and puffing because you're working out, right? So there's greater risk of transmission in those settings.
So let me ask you this. So obviously today, you know that today we have more COVID-19 cases than ever before recorded, right?
1,048 is the highest number. And we had the highest number as well in Mississauga in quite some time, 72 cases.
Yeah.
Brampton 213.
So does this worry you that we're opening up this
Yes,
Saturday?
it does seem like a contradiction.
Yeah.
However, we have to be very careful, but we also know that the restaurants and the bars and the gyms aren't the source of the transmission. Now, they were closed because it was a good best practice globally that that's where you shut down first. So the trade-off, as I said, was we're going to open those, restrict them, but allow them to open, but look at imposing other measures within the community to prevent community spread. So whether they be weddings, like again, I'm announcing things that haven't been announced because I'm speculating and I shouldn't do that. But he's looking for areas where we could decrease the risk of social transmission and,
Okay.
gatherings in private settings. I think, Mayor Brown said on a call last week that he did kind of an anecdotal survey and said to people, now that restaurants are closed, have you stopped meeting with people? And the response was, oh no, we still meet with people, except we don't do it in a restaurant. We do it in our home now. We have a dinner party.
Yeah.
In that lunchtime meeting, that meeting you were going to have, that business meeting, you can't have it at a restaurant. Restaurants are closed. So does that mean that you are on a Zoom call or on a WebEx call? And the response was, well, no, we're doing it in the boardroom and we bring takeout. So
True.
it was pushing it into the private settings where there's less control. So there is more control in the restaurants because people are watching you, whether you have your face covering on when you walk in or not. Presumably you're, at least 6 feet apart sitting across from the people on the table. And now you're restricted how there can only be 4 people at that table. So the right measures are put in place. I mean, I know that when you looked at the modeling, the evidence that they presented rather, the incidence of transmission from retail, grocery, commercial, etc., was higher. True, but mostly that was amongst staff members. It wasn't transmission, let's say, in a grocery store from staff to patron. It was staff to staff, and it was always felt that in those settings was safer because you were wearing your face covering, and you may pass people in a hallway and an aisle, but you
Yeah.
weren't sitting across from them for an extended period of time having dinner and talking and communicating. So the risk of transmission, we were looking at the risk of transmission, and it's lower. Just don't understand why my
Um,
sound was on. Mm-hmm.
One thing I do is I watch too much news, I'll be honest with you. And I watch, obviously, all your interviews, all Dr. Lowe's interviews. And this weekend, Dr. Lowe, I heard him say that it wouldn't be wise for, Peel to open up based on the numbers in Brampton. So what are your thoughts on this? I mean, because at the end of the day, he said it wouldn't be wise, and we're doing exactly the polar opposite.
Well, the problem is that we otherwise penalize Mississauga establishments.
Yeah.
And we are very close in a number of the parameters to the protect category going alone. So, and in fact, when you look at it, that without us, their numbers are actually higher on the incident rate. So when I look at the per 100,000, let's say, so the categories as described, weekly incident rate of between 40 to 100 per 100,000 puts you in restrict. So Peel is at 92. In the yellow category, protect, it's incidents per 100,000 of 10 to 40. Mississauga is at 40.
Okay.
Right? Same with the R factor, we're at 1.1, and the positivity rates as well. So our positivity rates, the positivity rates are higher, that's for sure. In protect category, you're 1 to 2.5. In the restrict, 2.5 to 10. Now, we've taken a different approach to testing, let's be honest. So if you're sending people to a test site because they're symptomatic and potentially COVID positive, guess what? You're going to have a higher positivity rate, as you've seen. In Brampton, it's 9.9 or 9.6, whatever it is, almost 10. Mississauga, it's 4.5. So we're not in the same, we're still in the restrict category. And the R factor, we're lower, we're 1.1. But that makes sense on the positivity ratings, given that, we're asking people to go to test centers who are symptomatic,
True.
right? So that does make sense. And the numbers of testing have gone down since we are asking asymptomatic people to go to pharmacies, and since it's by appointment only now, right? They are lower than they were. So it does make sense, right? So, but there are certain criteria that we meet in the protect category. But we're one public health unit. What can I say? If we continue to diverge, I'll certainly make the case for Mississauga. But then, we want people to be cautious. We want them to continue to be vigilant, right? And so moving us into another category, do we want to do that, or do we want to protect people and keep them safe?
I asked Premier Ford that question yesterday.
What did he say?
He didn't give me much of an answer. I asked if Mississauga can, open up before Brampton, and he said that pretty much. I don't know what he said, but anyways, he didn't really answer the question. That's exactly what he did. He did it with a smile, right? So, but,
I'm sure he would like to, but given that we're one public health unit, it does make it challenging. Now, he did talk about a targeted approach, a surgical approach, but the virus travels, right? The virus travels too. So we just want to keep everybody safe. If our numbers are diametrically divergent, then of course I'll ask for it, and of course it would make sense. We are lower, but we don't meet all the criteria in the yellow category yet, but we're getting there. We're getting there. I know I've heard from some businesses that they're disappointed, but on the other hand, I've heard from residents that, we're questioning whether we're moving too fast, just like Dr. Lowe. So we have that balance. We have to balance the economy versus public health.
But this is also confusing. I mean, I'm in the media, you're the mayor, and trying to explain it to everybody that's, the residents.
That's right.
So at the end of the day, Saturday, Mississauga opens, or Peel opens. Dining opens until 9, 4 people indoors, seating. Gyms 50, people inside, you have to be 3 meters apart. Okay, there we go.
And 10 per class, you got it, 10 per class.
Okay.
Yeah, we're 25 outside right now for my F45, right? Because we do it outside.
Okay.
So we get 25 people in the class, and we do it out in the parking lot. So I don't know. I don't mind doing it outside. I just wear a bunch of layers and keep peeling them off.
Okay. How often do you do it now? How many times a week?
It depends, 2 or 3.
That's hard.
It's enough. It's hardcore. I did it 3 times last week. I've done it twice. So what day is this? Wednesday. I've done it once. I'm doing it tomorrow, so that's twice already. So
I did see the Halloween picture, so.
Yeah, I had my bunny suit. It was kind of a last minute thing. I didn't have a lot of time to prep. There were some people with some pretty fancy costumes, and I felt a little bad. I didn't put more thought into it. So, and it was only on briefly for the photo anyways, because then it became too warm to wear while we were working out. But some people put a lot of effort into it, and kudos to them. It was a lot of fun. So.
True. Let's talk about Halloween. How many tickets did the city issue over the Halloween?
Shoot. I wanted to look at the, hang on, let's see if I can get that up while we're speaking. Keep talking.
There was I heard that there was a couple of parties in Mississauga.
Which one did you hear about specifically? Maybe I can address that one.
Oh, well, I saw a video. Saw your comment, or we saw your comment, and so I heard, and the thing is, I heard that there was one at a city center establishment. I'm not going to say their name.
Correct, don't. Okay, alleged.
Right. But there was a party there, I know that much.
There was, and there are lots of photographs of it as well. Hang on, I'm just trying to get I've got everything ready. I've got the new framework. I've got our today's numbers, but I didn't have the bylaw numbers.
No. Well, can you? Do you remember?
No, hang on. Here they are. I got them.
Okay.
I think I have my screen open here in front of me. I've got all these. I've got the space deck here. I've got the space deck here. Yeah. the space deck here in front of me with all these screens and laptops and iPad here and a laptop here and 2 screens right there. Okay, let's see, public complaints. This past week, there have been 90 public complaints.
90.
Public complaints, so 311
Okay.
calls. And people should know that the place to call is not the mayor's office on Saturday night. 311. 311 will take your call. Remember that. Also,
You're going to get
businesses,
double the
including
amount.
masks, right? Gatherings, non-property. But this was, okay, fines. There were two
Okay.
fines of businesses. And I think that was because they were open. Yeah, stages 1 to 3. That just means they were open and shouldn't have been. Or serving people. Restaurant permitting inside dining. It was 1, and the other one was restaurant lounge, fully enclosed exterior space. Fully enclosed exterior space. So if you have a tent and all 4 sides are up, that's illegal.
Okay, so let me ask you this question, because that was my next question. Some restaurants have an enclosed dome or tent for parties for one. How is the city planning to handle these requests, especially since the domes are meant for 1 table and therefore be theoretically at least safer than a fully enclosed tent? So
correct. If you only have 4 people there or 2 people there or whatever that. But the issue there also is you can't put a propane tank in there if it's fully enclosed, right?
okay.
That's a safety measure. That's against the bylaw restrictions, right? So that's part of the problem. You've become indoor dining outside by having all 4 sides down. The point is we need the air to flow to circulate, and you can't put propane tanks inside in this interior space that has all 4 sides. So they have to have 2 sides up. So there was one restaurant was permitting inside dining. Don't ask me who, because I couldn't tell you, even if I knew, which I don't, doesn't say. The second one was fully enclosed exterior space. So that can happen. You have to have sides up. And with respect to the alleged late night party at said alleged downtown resto bar, so there will be charges being processed against said establishment. So
Okay. Interesting. Okay. Budget
it's
time.
interesting when you post that, and all the people who, some people didn't want to disclose right on, publicly on the Facebook, but certainly lots of messenger messages or direct messages or, text messages, lots and lots and lots.
All
And
you have to do.
More photos and
All you have to do is look at their Instagram stories that night. So
right, or I guess Snapchats, and Instagram stories will do it for sure.
Yeah.
You can send me those, I get people right on it.
Okay. Budget time is coming. We're changing the subject totally. Budget time.
Okay, budget time.
What impact does this COVID-19 shutdown impact for like big projects like, the central library and stuff like that? Is there any impact for major projects?
So all the projects in our capital plan had been funded and are proceeding. So it's anything that was, debt finance that we could delay, we would. But if it's already funded through the capital plan, then it's already funded. And
but are they delayed?
Of its tax. No, they're proceeding. There's some of them are kind of, there have been some delays here and there, but for the most part, those capital projects are proceeding that are already in the plan and already funded.
Okay.
Yeah.
All right. So Hazel will still get her.
She sure will. Okay. She sure will. That's kind of exciting, right? She and I had a nice conversation about it after we had the vote we had the conversation in camera. And then we put it to formal motion last week. And so, I'm sure she's pretty excited. It's important to recognize her for her contribution. Certainly a friend and a mentor to many of us. It is the place we chose to live in a city, the state of Mississauga, that, she molded in her vision for 36 years. It's quite an accomplishment. And so, I'm very proud of her and want to honor her. And it's important that the city recognize her, that there are many namings for Hazel McCallion across the city, whether they're at the hospital or they're at UTM or Sheridan College or different places. But it was important that the city acknowledge the contribution she made as well. And it's nice that it's in the downtown and it's the library and it'll face out into the square. There was a sense that the square has been branded Celebration Square, and we're branding ourselves a little bit as kind of the festival city. So the square naming wasn't quite the right naming, but we all liked the library, and so she's written books too. So yeah, it was the right thing. And there's an opportunity maybe to have museum exhibits in the library as well, right? And I know that always of great interest to people when we have a Hazel exhibit. So yeah, it's very exciting. And we'll do an unveiling of the proposed plaque hopefully with her at the council chamber when we have it ready. And then it would go up February, I think it was I think it was the 10th we planned it. Birthday, of course, is the 14th, but the closest council meeting would be the 10th.
Oh, okay. Okay. He's doing okay? Hazel McCallion? How is Hazel McCallion doing okay?
Yes.
Okay.
Yes, I do see her from time to time. And we were speaking through the first phase. For the first wave, we were speaking every week, sometimes more often, but every week. And then, summer, everybody goes a little lax. And then I didn't speak to her quite as often, and I've actually run into her a few times at some things that we both did, groundbreakings and such, business openings. And yeah, and then I called her to talk about this, and she was in great spirits and just loved the idea and was very grateful and just feisty as ever. God bless her. Who has that much energy ever, let alone somebody who's 99?
I can't believe she's
she really is quite a phenomenon.
Yeah, she's awesome.
Imagine she has all her cognitive skills. She races up and down the platforms. She's so full of energy, and she's 99.
Yeah.
There are days I don't feel that energetic, and she does.
You are doing at 45.
Yeah, I am.
Last question. Who's going to win tonight?
I feel like if I say it, I'll jinx it.
Okay. All right.
But so I won't say it, but I'm quite hopeful that the large turnout in the advance polls means change, because normally large turnout means change.
Yep, you're right. All right, grab the whiskey, grab the popcorn, and enjoy the festivities tonight.
Yeah, we'll be watching with bated breath. Now, I guess the question is, will we find out tonight, or will it be, days before all the mail-in ballots are counted? I heard like 100 million mail-in ballots, 100 votes. So that's, and I don't know. And there are some states that are allowing counting after the election. So that as long as they were postmarked by today, so that maybe a few more days. So it just depends on if they're material enough or if significant votes have been counted to declare a winner. I'm up for I'm ready for a late night. I'm up for that. I only have council tomorrow morning. What's more important?
Well, it's on TV tomorrow. So
yeah.
Most votes since 1908. But Mayor Crombie, thank you so much.
Right?
Yeah. It's,
already.
Yeah. So.
Goodness.
Yeah, and I know you're busy. It's 5 o'clock. I've had you for 30 minutes.
Wow.
See you next week.
Thanks very much. Thank you. Bye-bye.